Providing mouth care. Mouth care promotes good oral hygiene. If not performed correctly or infrequently, it can lead to dental cavities, infection, loss of the teeth, and bad breath. You will have 3 to 5 minutes to complete this skill. You will need 1 washcloth, a large towel, toothbrush, toothpaste, disposable cup, an emesis basin, 2 paper towels, and gloves.
All right, good morning, Miss Nisha. Let me check your wristband. I'm just going to be brushing your teeth this morning before we have breakfast or lunch. Is that okay?
Yeah.
Okay. So I'm going to go ahead and put the bed up all the way to waist level. The way you bring your patient up to you. You're going to be standing while you brush. Okay, Miss Kanisha, I'm going to go ahead and raise the head of your bed up. The bed needs to be 75 to 90 degrees to make sure your patient does not aspirate. So it's better if you actually stand to the side. You can actually tell a little bit better, gauge it better of how high up your patient is. If you stand from the front, it's kind of hard to see. Okay. So I'm going to go ahead and walk around to the other side of the bed and close the privacy screen. Okay, Ms. Kanisha, I'm going to go ahead and go wash my hands and get our supplies, and I will be right back. Let's go ahead and set my table up. Just go ahead and pull your sheet up. Keep you covered. Okay, so I'm going to wash my hands, simulate it. I'm going to grab my supplies and go back in. So as you notice, when I grab my supplies, nothing touches the table except for the towel. You don't want the cup and all that to touch the table, so it goes from the towel. And then you go ahead and sit your barriers down. That's what your paper towels are for. Open them up completely. And then you sit your basin and your cup and all of your supplies on the barrier, not the table. And you also want the washcloth on the barrier as well. So everything, this is your clean barrier. What's closest to the patient is clean. As you use everything, you're going to move it over to the dirty. So this is also our clothing protector, which is a towel. This keeps us from dirtying up Miss Kanisha's clothes. So I'm going to put this on your chest if that's okay. Okay. So now I'm just going to go ahead and walk over to the sink and wash my hands and get you some water for rinsing. So walk over to the sink. Okay, so we're going to go ahead and get the rinse water. So you want to get a paper towel, turn the water on if the faucet is contaminated. Remember that. You don't want it too hot or too cold. We're going to test that in a minute. So you're going to wash your hands, stimulate it for state. And you want to test the water, make sure it's not too hot, not too cold. Okay, get another paper towel, dry your hands, clean paper towel, turn the water off, go ahead and throw that in the trash. Let me go ahead and walk back over to the bed and proceed with the skill. Okay, now that we've gotten the water, I'm going to go ahead and put my gloves on. Okay, so we're going to use a brand new toothbrush. You always want to wet your toothbrush before you put the toothpaste on it. So you can either dip the toothbrush in the cup or you can actually pour water over the toothbrush. I'm going to go ahead and dip it in the cup. A little bit of toothpaste on it. Doesn't take much for this skill. The lid back on it. Now this goes on the opposite barrier. So you want to brush all the top first, circular motion, all the top. And then all the bottom, and then the tongue. And back the table up a little bit. Okay, so we're going to brush the top. We're going to brush the side. We're going to brush the other side. And then say ah for me. You're going to get the molars. And you get the other molar. Then behind the teeth, be very gentle. Behind the teeth that way and behind the teeth that way. Now we go to the bottom and do the same exact thing. Circles in the front, circles in the back, circles on the other side. Then we get the molars, upper molar, and then we go behind the teeth. And then we brush the tongue. Brush straight down. And then that goes in the dirty barrier. And we let your patient rinse and spit at least twice. Let me go one more time, make sure we got it all out. If they need more, we can give them more, but a minimum of 2 times. Okay. Put that in a dirty barrier, then you get your washcloth and you wipe your patient's mouth and their chin, and you take that and you just roll it into the towel together. Put them both in the dirty laundry. Okay, Miss Kenesha, I will be right back. So pick your toothbrush, your toothpaste up, and your basin in the same hand. Don't put it in the basin because the basin has the water that you spit out. Then grab your cup with your hand, and then grab your 2 barriers together. Don't sit the cup on the table. I'm going to carry them both out together. We're going back to the sink. Okay, so I'm going to go ahead and dump the water into the sink, the leftover water from the rinsing. Put the cup and the napkins into the trash. And now we're going to grab a paper towel, turn the water on so we can rinse the basin. Okay, so now we're going to dump the basin. We're going to rinse and dump twice. And then we want to pat it dry. Inside first, and then outside. And bottom. Okay, you can go ahead and sit the basin down. The toothpaste goes inside the basin. We're going to rinse the toothbrush and then put that in the disposal area, which will be the garbage at this moment. And then we're going to go ahead and remove our gloves the right way. The gloves in the trash. Simulate washing our hands. With clean paper towel, turn the faucet off. I'm going to go ahead and put our cup into our basin into the designated area until later use. Throw the towel away. Okay, Miss Kenesha, we're all done. Go ahead and put everything back where it's supposed to be. I'm going to put your bed back in the lowest position. So we're going to go down. How do you feel? Nice and minty fresh?
Yep.
The bed goes into the lowest position. Do you want the head of your bed to stay up, or you want me to put it down some?
Down some.
Okay, tell me when to stop.
Right there.
Okay. Okay, so I'm going to go ahead and remove the privacy. So I'm going to walk around to the other side of the bed. And while you're here, just go ahead and fix the sheet. Make sure everything is straight. Okay. Make sure Miss Kenesha has her call lights. Here's your call light, and you can, in case you need to reach me. Is there anything I can do for you before I go?
No.
Okay, so I wash my hands, document the procedure, and the skill is complete.